The growing concern of diabetes in the elderly. As the global population ages, chronic health conditions like diabetes are becoming more prevalent, especially among the elderly. Type 2 diabetes, which is the most common form, is particularly concerning because it often develops gradually over time and may go unnoticed for years. By the time symptoms appear, the damage to the body can already be significant. This makes early detection and management critical, especially for seniors, as they are already vulnerable to a variety of age-related health complications. Diabetes is a condition that affects how the body processes blood sugar, glucose. Insulin, a hormone produced by the pancreas, plays a crucial role in helping the cells absorb glucose from the bloodstream to be used as energy. In people with diabetes, either the body does not produce enough insulin, or the insulin it produces is not used effectively, insulin resistance. As a result, glucose builds up in the blood, leading to various health problems, such as heart disease, kidney damage, nerve issues, and vision problems. For elderly individuals, the risk of developing diabetes is even greater due to several factors. As people age, the body's ability to process insulin becomes less efficient, and metabolic changes can make it harder for the body to manage glucose. In addition, many older adults have other risk factors that make them more susceptible to diabetes, such as obesity, high blood pressure, and high cholesterol. These conditions, when combined with the natural aging process, can accelerate the development of type 2 diabetes. What makes diabetes particularly dangerous for the elderly is that its symptoms often develop slowly and may be dismissed as part of normal aging. Many seniors experience fatigue, weight loss, or increased thirst as a part of getting older, without realizing these could be early signs of diabetes. Additionally, elderly individuals may already be managing other health conditions, which can mask the onset of diabetes or complicate its diagnosis. It is important to understand that diabetes is a silent disease. Many people with diabetes do not experience obvious symptoms in the early stages. This is why awareness is crucial. For elderly individuals, recognizing the early warning signs of diabetes can make a significant difference in the progression of the disease. When diagnosed early, diabetes can be managed effectively with lifestyle changes, medication, and regular monitoring of blood sugar levels. However, if left untreated or poorly managed, diabetes can lead to debilitating complications that severely impact the quality of life and even result in premature death. In this article, we will explore the 5 most common warning signs of diabetes in the elderly. By understanding these symptoms and taking proactive steps toward diagnosis and treatment, older adults can manage their condition more effectively and avoid the long-term complications that come with untreated diabetes. Whether it's feeling unusually tired, frequent urination, unexplained weight loss, slow healing wounds, or vision problems, recognizing these signs early is essential for improving the overall health and well-being of seniors. We'll also discuss important prevention strategies and how families and caregivers can play a role in supporting older adults who may be at risk for diabetes. Early intervention is key, and this article aims to provide both knowledge and guidance on how to identify and address the risks of diabetes before it's too late. Sign 1. Constant fatigue and weakness. Fatigue is a primary symptom of diabetes, especially in older adults, and can be one of the most noticeable early signs of the condition. Unlike regular tiredness or sleepiness from physical activity, fatigue in diabetes is persistent, overwhelming, and often doesn't improve after a night's rest. This constant exhaustion can significantly impact daily activities, reducing the person's ability to engage in social, family, or work-related activities, and can decrease their overall quality of life. Why does diabetes cause fatigue? The primary reason for fatigue in people with diabetes is related to how the body handles glucose. Normally, when we eat food, our body breaks it down into glucose, which provides energy for our cells. However, in diabetes, the body either becomes insulin resistant, in type 2 diabetes, or is unable to produce enough insulin in type 1 diabetes, which means glucose cannot effectively enter the cells. As a result, glucose builds up in the blood, leaving the cells without the energy they need to perform their normal functions. Without enough energy in the cells, the body begins to feel tired and weak. This is made worse by other factors that are common in people with diabetes, such as dehydration from frequent urination and poor circulation, which is a common consequence of prolonged high blood sugar levels. How dehydration contributes to fatigue. Diabetes often causes the kidneys to work overtime to filter out excess glucose from the blood. This increased urination results in fluid loss, leading to dehydration. Dehydration, in turn, exacerbates feelings of weakness and low energy, as the body becomes less efficient in performing essential functions. The loss of electrolytes during frequent urination further contributes to the overall fatigue and weakness. Additionally, when blood glucose levels remain high over time, the nervous system can also be affected, causing what's known as diabetic neuropathy. This nerve damage can interfere with normal bodily processes and contribute to fatigue by making the body work harder to maintain balance. How to recognize fatigue from diabetes. Persistent exhaustion that doesn't improve with sleep or rest. Lack of motivation to engage in everyday tasks like walking, eating, or dressing. Mental fatigue, difficulty concentrating, forgetfulness, or brain fog, due to the lack of glucose available for brain function. Weakness and sluggishness, making it difficult to perform regular tasks. If someone is constantly feeling fatigued without any clear explanation, it could be a sign that their blood sugar is high and should be tested. Addressing this issue with proper medical intervention can help improve energy levels and overall well-being. Sign 2. Frequent urination and excessive thirst. One of the most noticeable symptoms of diabetes is frequent urination, polyuria, and excessive thirst, polydipsia. These symptoms often occur together and are both related to the body's attempt to remove excess glucose from the bloodstream. While frequent urination and thirst may not seem alarming at first, they can be a clear sign of high blood sugar and should not be ignored. Why do frequent urination and thirst occur in diabetes? When the blood sugar level is too high, the kidneys attempt to filter and remove the excess glucose through urine. As glucose is excreted, it pulls water with it, which increases urine production. This results in frequent urination, especially during the night, which is called nocturia. Because the body is losing so much water, the individual becomes dehydrated, which triggers the sensation of extreme thirst. This cycle can cause the person to drink large amounts of fluids to rehydrate, but due to frequent urination, the body cannot retain enough water, leading to continuous thirst. For elderly individuals, this constant need to drink water and urinate can disrupt daily activities, leading to discomfort and possible embarrassment. How dehydration affects the body. As the body loses more fluids than it can replace, it begins to show the signs of dehydration, including dry mouth, dizziness, and weakness. This can further exacerbate the fatigue associated with diabetes and make the person feel more sluggish and unwell. If not addressed, prolonged dehydration can lead to serious complications such as kidney damage. How to recognize frequent urination and thirst from diabetes. Increased urination, especially at night, which leads to disrupted sleep. Constantly feeling thirsty, despite drinking large amounts of fluids. Dry mouth and the need to drink water more frequently. Dehydration symptoms including dry skin, cracked lips, and low energy. Frequent urination and excessive thirst are common symptoms that should not be ignored. If these symptoms persist for more than a few days, especially when accompanied by fatigue or weight loss, it's important to have blood sugar levels checked. Early intervention is key to preventing further complications. Sign 3. Unexplained weight loss. Unexplained weight loss is one of the most alarming and significant signs of diabetes, especially for seniors. Unlike the normal weight fluctuations caused by diet changes, stress, or lifestyle, unexplained weight loss in diabetes occurs even when a person is eating normally or even more than usual. This symptom is often mistaken for other conditions but should be taken seriously, particularly when it occurs alongside other symptoms of diabetes. Why does diabetes cause weight loss? In diabetes, the body cannot properly use glucose due to insulin resistance or a lack of insulin production. This means the body can't get the energy it needs from glucose, so it turns to alternative energy sources, fat and muscle tissue. When fat and muscle are broken down for energy, the result is rapid weight loss, even when a person's diet or calorie intake remains the same. Moreover, people with diabetes often experience increased hunger, as the body tries to find energy from food. Despite feeling hungry and eating more, the body still loses weight because it cannot properly absorb the glucose from the food being consumed. How does unexplained weight loss affect the elderly? For older adults, unexplained weight loss can be particularly concerning. Rapid weight loss can lead to muscle wasting, making it difficult for seniors to maintain strength and mobility. It can also result in nutritional deficiencies, where the body is not receiving enough of the nutrients it needs to stay healthy. This can make the person more vulnerable to infections, bone loss, and other age-related complications. How to recognize unexplained weight loss from diabetes. Sudden weight loss without any significant changes in eating habits or physical activity. Muscle loss, which may result in a frail and weakened appearance. Constant hunger, yet continuing to lose weight, as the body isn't absorbing glucose properly. Fatigue and weakness, as a result of muscle depletion and insufficient energy. If an elderly person is experiencing weight loss, especially if accompanied by fatigue, excessive thirst, and frequent urination, diabetes should be considered as a possible cause. It is crucial to seek medical advice and have their blood sugar levels tested to confirm the diagnosis. Sign 4. Slow healing wounds. A common but often overlooked sign of diabetes in older adults is slow healing wounds. When the body cannot process glucose properly, it impacts many of its functions, including wound healing. For people with diabetes, even minor cuts, scrapes, or injuries can take significantly longer to heal than normal. This delayed healing process makes the elderly more vulnerable to infections and complications from seemingly minor injuries. Why do wounds heal slowly in diabetes? When blood sugar levels are too high, the body's circulation is compromised, and it becomes more difficult for oxygen and nutrients to reach the affected area. This reduced circulation slows down the body's ability to heal wounds, and can even cause wounds to reopen or become infected. Additionally, high blood glucose levels impair the immune system, making it harder for the body to fight off infections. Over time, this can lead to chronic wounds or diabetic ulcers, especially on the feet or legs, which are common in people with diabetes. If not treated promptly, these ulcers can become infected and may lead to more serious complications, such as gangrene or the need for amputation. How to recognize slow-healing wounds from diabetes. Wounds, cuts, or abrasions that take longer than usual to heal. Frequent skin infections, especially around wounds, which may become red, swollen, or produce pus. Swelling, redness, or pain around the wound site, which indicates possible infection. Recurrent wounds that keep reopening or become chronic. It's important to monitor any wounds, especially on the feet, as people with diabetes often experience neuropathy, nerve damage, which can reduce the ability to feel pain. If wounds are not healing as expected, it's essential to see a doctor for proper care and treatment. Early intervention can help prevent more serious complications and improve healing time. Sign 5. Blurred vision and eye problems. Blurred vision is a frequent symptom of diabetes, and it often goes unnoticed until it becomes severe. High blood sugar levels can affect the eyes in several ways, and over time, they can lead to more serious eye conditions like diabetic retinopathy, cataracts, and glaucoma. In fact, people with uncontrolled diabetes are at a higher risk of developing these eye diseases. Why does diabetes affect vision? When blood sugar levels are too high, the body's fluid balance is disrupted, causing fluid to accumulate in the lens of the eye. This swelling makes it difficult for the lens to focus, leading to blurry vision. In some cases, the blurred vision may improve when blood sugar levels are stabilized. But if diabetes goes unchecked, it can cause permanent damage to the eyes. How does high blood sugar affect eye health? Long-term high blood sugar levels can damage the blood vessels in the retina, leading to a condition called diabetic retinopathy. In this condition, the blood vessels in the retina leak or become blocked, leading to vision loss or even blindness if left untreated. High blood sugar also increases the risk of developing cataracts, clouding of the eye lens, and glaucoma, increased pressure inside the eye, both of which can lead to severe vision impairment. How to recognize vision problems from diabetes. Blurred vision, especially when trying to focus on objects or reading. Double vision that may come and go. Seeing spots or floaters in the field of vision. Frequent changes in glasses prescription, or difficulty seeing in low light conditions. Regular eye exams are essential for individuals with diabetes. They can help detect early signs of diabetic eye diseases and prevent permanent vision loss. Seniors with diabetes should consult their eye doctor annually to ensure their eye health is monitored closely. Above are the signs of diabetes, and next we will move on to how to prevent diabetes in the elderly. Preventing diabetes, especially type 2 diabetes, in the elderly is very important because the risk increases with age. Although diabetes is influenced by genetic factors, lifestyle changes play an important role in preventing or delaying the onset of the disease. By adopting healthy habits, seniors can significantly reduce their risk of diabetes and improve their overall health. Here are effective prevention strategies for the elderly. 1. Maintain a healthy weight. One of the most important factors in preventing diabetes is maintaining a healthy weight. Excess body fat, especially around the abdomen, contributes to insulin resistance. When the body becomes resistant to insulin, it can no longer effectively process glucose, leading to elevated blood sugar levels. For elderly individuals, even a small reduction in weight, around 5 to 10% of body weight, can significantly improve insulin sensitivity and help lower the risk of developing diabetes. Seniors should aim to achieve and maintain a healthy body mass index, BMI, through a combination of balanced nutrition and regular physical activity. 2. Stay physically active. Regular physical activity is one of the most effective ways to prevent and manage diabetes. Exercise helps improve the body's use of insulin, which helps lower blood sugar levels. For seniors, engaging in at least 30 minutes of moderate exercise 5 days a week can make a significant difference. Physical activity doesn't need to be intense. Even simple activities like walking, swimming, yoga, or light stretching can be effective. Exercise also helps maintain a healthy weight, reduce stress, and improve overall cardiovascular health, all of which contribute to preventing diabetes. 3. Eat a balanced diet. A healthy diet is crucial for maintaining stable blood sugar levels and preventing diabetes. Elderly individuals should focus on eating a diet that is rich in whole grains, fruits, vegetables, lean proteins, and healthy fats. This type of diet helps regulate blood sugar levels and prevents spikes in glucose. Seniors should aim to limit processed foods, refined sugars, and sugary drinks. Focus on high-fiber foods such as vegetables, fruits, and whole grains, which help stabilize blood sugar. Incorporate healthy fats like those found in olive oil, avocados, and nuts. It's important for elderly individuals to eat smaller, more frequent meals throughout the day, as this can prevent large fluctuations in blood sugar levels. 4. Monitor blood sugar levels regularly. For those at higher risk of diabetes, regular monitoring of blood sugar levels can be helpful. This is especially important for individuals with a family history of diabetes or those who are overweight. Regular checkups with a healthcare provider can help track blood sugar trends and catch early signs of diabetes before they become more serious. 5. Manage stress and get enough sleep. Chronic stress can increase blood sugar levels and contribute to insulin resistance. Seniors should focus on managing stress through relaxation techniques such as deep breathing, meditation, or spending time with family and friends. Quality sleep is equally important, as poor sleep can negatively affect blood sugar regulation. Seniors should aim for 7 to 9 hours of sleep per night to support overall health and well-being. Conclusion and advice. Diabetes is a chronic disease that poses significant health risks, especially for elderly individuals. Its early signs like fatigue, frequent urination, unexplained weight loss, slow healing wounds, and blurred vision can be subtle and often mistaken for typical aging symptoms. However, recognizing these signs early and seeking medical help is crucial for effective management. Early detection of diabetes not only prevents severe complications like heart disease, kidney failure, and blindness, but also improves the overall quality of life for seniors. As we have seen, diabetes can be managed successfully with proper care, and adopting healthier lifestyle habits can prevent or delay the onset of the disease. A balanced diet, regular physical activity, weight management, and stress reduction are all essential components of diabetes prevention. These habits benefit not only those at risk but also seniors who already have diabetes, as they can help regulate blood sugar levels and prevent long-term complications. For elderly individuals, making small but impactful changes to daily routines can significantly improve health outcomes. Engaging in regular exercise, such as walking or swimming, can improve insulin sensitivity and lower blood sugar levels. Eating a nutrient-rich diet that includes plenty of vegetables, fruits, Whole grains and lean proteins can support overall health while keeping blood sugar stable. Managing stress and getting enough sleep are also essential, as chronic stress and sleep deprivation can exacerbate blood sugar imbalances. However, lifestyle changes alone may not be enough for some individuals, especially those with a family history of diabetes or those already diagnosed with prediabetes. In such cases, regular medical checkups are essential. Healthcare providers can monitor blood sugar levels, provide early interventions, and adjust treatment plans as needed. Seniors should schedule annual checkups with their doctors to ensure their blood sugar is within a healthy range and discuss any concerns regarding symptoms or lifestyle changes. For caregivers and family members, supporting an elderly loved one in adopting healthier habits is key. Encouraging regular physical activity and preparing nutritious meals can make a significant difference in managing or preventing diabetes. It's also important to check in regularly with seniors about their symptoms and encourage them to seek medical advice if any changes occur. Lastly, it's important to understand that diabetes is not a death sentence. It is a manageable condition. With proper care, individuals with diabetes can live long, healthy, and fulfilling lives. The goal is not just to treat the disease, but to enhance the quality of life by controlling blood sugar levels, preventing complications, and maintaining independence.